So the next one is, since progression is clonal, how comfortable are you with adding chemotherapy to a first-line ROS1 medication in order to extend time on the initial TKI? So I can take this one first, and maybe Dr. Kim, you can comment on it as well. So it's definitely not standard of care to use both ROS1, TKI, and chemotherapy together at initial diagnosis. I would say in, again, EGFR mutant lung cancer, there is currently an ongoing clinical trial precisely to explore this question of, is it beneficial to use TKI plus chemotherapy up front to try and kind of maximize the response at the initial treatment level, and lengthen the duration of disease control. So there's a FLAURA2 trial in EGFR mutant lung cancer where they're looking at osimertinib together with platinum doublet chemotherapy. I'm not aware of a similar trial happening exactly in the ROS1 space, but I do think what we see from that FLAURA2 trial will be informative, because we tend to think of these actionable oncogen-driven lung cancers, particularly EGFR and ROS1, as kind of conceptually similar. But right now, I'd say it's not standard of care to use both together up front.
I completely agree with Dr. Lin. So the current standard care is to do the ROS1 TKI first. I think in the future, the paradigm may change, and we may use other diagnostic tools. And for example, in EGFR cancer, non-small cell lung cancer sort of world, there is a clinical trial using the ctDNA to add chemotherapy or just continue EGFR TKI. And that kind of approach can be applied to ROS1, where, because we know that some patients may benefit from chemotherapy than others, but not everybody needs chemotherapy up front. So we need to know which patient will do well with the TKI alone versus, finding out patients who need the chemotherapy to really help reduce the resistant clones. And there's no such trial, as far as I know, in ROS1 non-small cell lung cancer at this point. But looking at other cancer type, as I mentioned, EGFR non-small cell lung cancer, I think those kind of approach can be applied to other cancer types in the future.